think about healthcare, you think about kind of a more biomedical model, right? The way in which we come at care is very much from a patient perspective or an individual perspective. And so we aren't really cultured, even within our clinical experiences, to be talking about these things or navigating these things as a family. And so, just even opening the lines of communication can be difficult. And then, there's relational tensions, right? We have within families, multiple generations. And so that means that we have different developmental goals depending on where we are in the lifespan. But it also means that we are socialized differently. So there's generational differences. And so there's, part of it is recognizing that what works for my mom might not work for me, and vice versa, or my grandparents. And I think one of the biggest things with families where you see those challenges is openness. Older generations were not socialized to be as open as younger generations are today. And some younger generations are socialized to pretty much have it all out there. So there's no boundaries. And that, those are, difficult, conclusions that we have to face, but also that we can navigate together. So mothers and daughters in breast cancer, it's a really rich relationship. Some people call it tangled vines. Other people call it blood ties. They have the potential to be very emotionally close over the lifespan, arguably one of the closest relationships, but also one of the most tense. And so navigating how to communicate about breast cancer, even other health-related issues, is really challenging. And my work really focuses on, what does that look like at different phases of the lifespan? The young adult daughters are the ones that I've been focusing on a little bit more. Namely because one of the things that I found in my research is that, moms who are diagnosed very much want to talk to their younger daughters about it. But it's those adolescent, emerging adult, adolescent up through age, mid-20s, where those daughters can be much more resistant to having those conversations. And part of that is it's their own way of coping. And some of it, for daughters on one hand, is kind of reframing the way you're thinking about those conversations. So daughters that tell us that, once I started realizing that not knowing things was much scarier, a bigger, more ambiguous thing than knowing things, having my uncertainty managed by talking to my mom about it, I was doing a lot better. The other side of that is, I liked supporting my mom. I like being able to be there for her. I felt it made me feel good. And so kind of flipping your perspective of that. One area that I've especially focused in terms of patient and provider and family communication is working with families who have a higher risk of hereditary breast or ovarian cancer, or HBOC. And so with those families, they're really dealing with what's been called psychological chronic uncertainty. This uncertainty where they feel it's not if I get it, but when I get it. And so in those settings, it's really about, helping clinicians help patients, but also patients' family members manage that uncertainty, because it's not something they deal with at one point in time, such as, deciding to get genetic testing or getting the genetic test result. It's something they deal with over the lifespan. And it's something that can be very psychosocially distressing. So some of the things that we've found in our research, particularly with genetic counseling, is one of the things that gets women to come in and do the genetic counseling is if they have daughters. And so they'll spend a lot of time talking about daughter-related uncertainty and daughters' reactions to their own uncertainty. And so part of that is really helping clinicians realize that the way in which they help their patients manage that uncertainty in the clinical setting is mirroring what they will do when they go home and help their daughter or other loved ones manage that uncertainty.